My name is Lauren Zamborsky, and I go to The Ohio State University. This summer, I worked at Cleveland Clinic's main campus, a part of the Science Internship Program for Nursing. This summer, my project was titled, "Does an Educational Program Change Perceived Values of and Barriers to Certification Among Peri-Anesthesia Nurses?" Some background on this information is that nursing certification is a means of external validation of specialized knowledge, skills, and experience to certain nurses. It is offered through examinations in different specialty areas, such as peri-anesthesia nursing. Registered nurses are eligible to take certification exams after a specified amount of specialty clinical experience. Nurses working in a peri-anesthesia setting have two different certification options. The first would be a certified peri-anesthesia nurse, or a CPAN, and these nurses mainly work in in-hospital PACU settings, or post-anesthesia care unit. The other would be a certified ambulatory peri-anesthesia nurse, or a CAPA. These nurses work in pre-op, phase 2 recovery, and ambulatory surgery centers. To be eligible to become certified, a nurse must be a registered nurse and work at least 1,800 hours in direct bedside care in a peri-anesthesia setting. Currently, at the Cleveland Clinic's main campus, there are 7 CPAN certified and 3 CAPA certified and 1 dual CAPA and CPAN certified nurses in the units included in this study. Our institution is reapplying for magnet status in 2012 and has set a goal of increasing overall certification by 2%. In order to obtain information on certification, a CNOL EBSCOL search was done in order to compile research articles pertaining to nursing certification. So far, little research has been conducted on certification in the peri-anesthesia nurse population regarding the benefits and motivators and barriers to certification. Some motivators include professional obligation and a certain goal, personal satisfaction, and nurses want to increase their credibility in their occupation. Current research is needed to identify peri-anesthesia nurse perception of the certification process and to seek a means to increase certification rates. Authors writing on the subject of nurse certification in general have identified 3 areas of benefits to certification, including the hospital, the nurse herself, and patients. Some hospital benefits include that mostly reimbursement is increasingly tied to patient care outcomes, and higher % of certified nurses reported fewer falls, fewer medication errors, and lower turnover rates. The reduced cost of nurse training through improved retention has also helped. Certified nurses may have also increased their commitment to their healthcare organization as they are certified. Some nurse benefits include the increased knowledge through preparation for the examination and in maintaining certification, an increased job satisfaction, increased sense of empowerment, which leads to increased autonomy and lower levels of job-related stress, and validated knowledge and critical thinking skills. Some patient benefits include that certified nurses may deliver safer care and increase patient satisfaction scores. The American Board of Nursing Specialties sought to further examine nurse perceptions of certification in regards to the barriers of certification. Surveys were sent to both certified and non-certified nurses who were members of the participating organizations. Some perceived barriers to certification include cost of the examination, cost to maintain the credential, lack of institutional support, lack of institutional reward, lack of time to prepare for the exam, lack of access to preparation materials, lack of financial benefit, and lack of external recognition. The perceived values were categorized into 3 areas: personal value, recognition by other, and professional practice. These could be grouped into intrinsic factors such as personal accomplishment and challenge, and extrinsic factors such as increased salary and recognition. It is consistent across both certified and non-certified nurses, these values. Non-certificants cited external values such as lack of recognition as a reason for not participating. The purpose of my study was to examine the effectiveness of an educational intervention on nurses' perception of certification in a peri-anesthesia setting. We hypothesized that the perceived values of certification will increase following the certification program education intervention. Perceived barriers to certification will decrease following the certification program education intervention, and that the rate of enrollment in certification will increase following the certification program education intervention. Some methods of the ways we are doing our research is that it is a prospective comparative study using a convenient sample and survey methods. We are to evaluate nurse perceptions of certification values and barriers before and after the education intervention. The rate of enrollment in certification examination and passage of the examination is hoped to increase. The setting and sample size of our study will be that all PACU and same-day surgery departments on the main campus of the Cleveland Clinic will participate with all of their non-certified nurses. The participants will be asked to complete 2 tools on perceptions of certification and a demographic form that they will take in the pre-intervention. There will be 2 tools on perception post-intervention and a 2-question sheet regarding enrollment and passage 12 months after the intervention. The educational intervention will be available to all nurses regardless of their intent to participate, and it will include the Kappa CPAN information boards, a different study with questions all around saying, are you smarter than a CPAN or a Kappa, and different independent study materials. The CPAN and Kappa information boards will hold information on specified certification exams via centrally located bulletin boards in each unit, and they will include information on the structure of each test, how to enroll, computer-based testing, reasons to become certified, and requirements for maintaining certification status. The Are You Smarter Than a Kappa or a CPAN will hold sample test questions, and they will be posted in each unit Monday through Thursday. The correct answers and rationales will be posted on subsequent days, Tuesday through Friday. We will continue for about 47 days in an effort to help nurses learn important content, help them realize they are knowledgeable about basic peri-anesthesia course material used. The independent study materials will allow nurses to have access to different materials created by the investigators on pediatrics, herbal medications and complementary therapies, care of pregnant patients, anesthetics, cardiovascular complications following anesthesia, reducing test-taking anxiety, and ASBAN standards. The way we will measure certification values and barriers from the nurses is from the Perceived Values of Certification tool, or the PVCT. This is an 18-question, 5-point Likert type scale that assesses nurses' values of certification. It was initially developed with the perioperative nurse population as a project spearheaded by the Certification Board of Perioperative Nursing. It has yet to be used with peri-anesthesia nursing population in the published literature. The Perceived Barriers to Certification tool, which is created by the investigator, is based on 14 factors identified in the literature. Nurses may cite more than one barrier, and more than one barrier may carry equal weight in terms of importance. It is a 10-point Likert type scale. The demographic questionnaire developed by the investigators will include items such as age, ethnicity, years in nursing, years in peri-anesthesia nursing, their highest nursing degree, and their highest degree. All PACU and same-day surgery nurses are invited to complete the pre-intervention packets via email invitation, posted signs, staff meeting announcements, and a 15-day period, or 2 weeks. Reminder emails will be sent to all individuals at day 4 and day 8 of the intervention. Blank pre-intervention packets will be available on all of the units. During the pre-intervention, participants will deliver their completed paperwork that has been placed in sealed envelopes provided by the investigators in sealed boxes available on each unit. The post-intervention, the same packets will be available for completion following the intervention period beginning on October 3rd, 2011 for 30 days. Only nurses enrolled in pre-intervention will receive post-intervention paperwork. The certification questions will be sent to participants 1 year later, unless the investigator team has been aware of certification exam enrollment and results. Investigators will enter all data into an electronic SPSS database that is developed for this study. There will be 70 CPAN eligible nurses and 28 CAPA eligible nurses on this study unit, seeking a 40% response rate or a sample of 39 nurses to complete both pre- and post-intervention paperwork. The response rate of 25 will be sufficiently large enough to determine if differences exist. For the values of certification, we will measure the outcome based on the changes in responses to the PCVT administered at baseline and after an education intervention. The barriers of certification will be measured upon the outcomes will be based upon changes in responses to the MPBCT administered at baseline and after an education intervention. Certification outcomes will be measured through nurse reports in 2 items: the rate of enrollment of CPAN and CAPA within 1 year of the introduction of the intervention, and the rate of passage of the CPAN or the CAPA at 1 year post-education intervention for all those who enrolled. I would like to give a special thank you to my mentor, Carol Pahotsky, and my co-mentor, Sandy Hossman, and I would also like to give a thank you to the Office of Civic Education Initiatives for giving me the opportunity to work with my mentors this summer. Thank you.